So in today's session, we are going to look at the axilla, and under the axilla, you should know the boundaries of the axilla, the contents of the axilla, and one content of the axilla. I will not look it in this video, and it is the brachial plexus. I will do it in a separate video, so stay tuned for that video. So welcome all. My name is Wallace Munyeri, and I'm the ARTERY. So let's start. Now the axilla. The axilla is the space between the upper arm and the side of the thorax, which is bounded in front and behind by the axillary folds, the anterior axillary fold and the posterior axillary folds. So you can see them here. This is the anterior axillary fold formed by the lateral edge of pectoralis major muscle. This is the posterior axillary fold formed by the tendon of latissimus dorsi muscle. Okay. Then it usually contains neurovascular structures that move from the neck towards the upper limb. Okay, so it is like a communication between the upper arm and the posterior triangle of the neck. Okay, so let's look at the boundaries now. The axilla or the armpit usually resemble a truncated four-sided pyramid and has an apex here, a base, and four walls: a medial wall, a posterior wall, okay, and the anterior wall the other side, and the lateral wall. Now the posterior and the anterior wall, they somehow converge towards the lateral wall. Okay, so the lateral wall is small since the anterior and posterior wall converge towards it. So let's talk about the apex or the cervical axillary canal, which is a passageway between the neck and the axilla. It is usually directed upwards and medially into the root of the neck and corresponds to a triangular space. It is this triangular space here, which is bounded in front. It is bounded in front by the clavicle. Yeah, this is the clavicle. Okay. Behind, this is posterior by the upper border of scapula. Okay. Then medially by the outer border of the first rib. Those are the boundaries of the apex. Okay. And it is also known as the cervical axillary canal. It is where the axillary artery and brachial plexus enter the axilla from the neck, and also the axillary vein usually leave the axilla into the neck via this cervical axillary canal or the apex of the axilla. Now let's look at the other boundaries. Now, the anterior wall of the axilla is formed by the pectoralis major muscle, pectoralis minor, subclavius, and the clavipectoral fascia. This is the pectoralis major muscle. Posterior to it, you find your pectoralis minor. Subclavius will be somewhere just underneath the clavicle. The clavipectoral fascia usually extend from the clavicle. Then it usually invests the surface of pectoralis minor before becoming the suspensory ligament of the axilla. Now the posterior wall extends lower than the anterior wall, and it's formed by the subscapularis muscle here. Also teres major, and also the tendon of latissimus dorsi. Okay, this is the tendon of latissimus dorsi. Then the tendon of latissimus dorsi usually wind around the teres major muscle. Now the medial wall, this is the medial wall, is formed by the upper part of serratus anterior. This is your serratus anterior muscle, with the lower limit of the axilla being defined as the level of the fourth rib. Now its lateral wall, which is not here, but it is formed by the coracobrachialis muscle, the short head of biceps brachii, and the tendon of the long head of biceps brachii in the bicipital groove. The other name of the bicipital groove is the intertubercular groove. Now the floor is formed by the axillary fascia. Now let me see if I can draw that. The axillary fascia, which extends from the anterior to the posterior axillary folds. Now we have an axillary fascia here extending somewhat like that. Okay, from the anterior to the posterior axillary fold. Okay, and from the fascia of also the fascia of serratus anterior to the deep fascia of the arm. So that axillary fascia extending from the fascia of covering serratus anterior to the deep fascia of the arm is the one that forms the frow. Then the frow is usually supported by the suspensory ligament. The suspensory ligament is like the downward continuation of the clavipectoral fascia. After clavipectoral fascia has invested pectoralis minor muscle, it usually continue to be attached to the axillary furrow as the suspensory ligament of the axilla. Okay. So I hope you have understood those boundaries. So axillary artery. Now this is one of the content of the axilla, which is the main arterial stem of the upper rib, and it is a continuation of the third part of subclavian artery. And it commences at the outer border of the first rib, enters the apex of the axilla by passing over the first digitation of serratus anterior behind the midpoint of the clavicle. Okay, so it usually enters the axilla behind the midpoint of the clavicle by passing over the first digitation of serratus anterior. So when subclavian artery just crosses the outer border of the first rib, it changes its name to axillary artery. Now, at the lower border of teres major, it normally becomes brachial artery. So axillary artery usually extend from the outer border of the first rib to the lower border of teres major. After crossing the lower border of teres major, it changes its name to brachial artery. Now, the axillary artery and the cords of brachial plexus are enclosed within the axillary sheath. Now, in the axilla, this axillary artery and the cords of brachial plexus are enclosed within this fascial sheath known as the axillary sheath, which is just a downward prolongation of the prevertebral fascia in the neck. So the prevertebral fascia in the neck usually extend into the axilla as axillary sheath. Now the artery is conveniently divided into three parts. Please remember this. It is divided into three parts by pectoralis minor muscle, which will close in front of it or anterior to it. Now, it has three parts. Now, the first part is the part, it has three parts. Let's name them. The first part, the second part, and the third part. Now, the first part is the one which lies above or medial to pectoralis minor. Second part is the one which lies deep or posterior to pectoralis minor muscle. The third part is the one which lies below or lateral to pectoralis minor muscle. Now, the lateral and the posterior cords are superolateral, and the medial cord posterior to the first part. Now, this is the relation of the first part of axillary artery to the cords of brachial plexus, with the lateral and the posterior cords superolateral to it in the first part, but the medial cord posterior to it. Then, to the first part of the artery, there is a loop. The loop connecting the lateral and the medial pectoral nerves usually lie anterior to the first part of axillary artery. Now, the second part has the three cords. The three cords are the middle, the medial, lateral, and posterior cords of the brachial plexus, lying lateral, posterior, and medial to it, as their name indicates. So, the lateral cord of brachial plexus will lie lateral to the second part of axillary artery. The medial cord will lie medial to the second part of axillary artery, and the posterior cord will lie posterior to the second part of axillary artery. Now, the third part of the axillary artery has the branches. Now, the branches from the cords of the brachial plexus having, in general, the same relation to the artery as their parent cords. So, the branches from the lateral cord will lie lateral to the third part of axillary artery. The branches from the medial cord will lie medial to the third part of axillary artery. The branches from the posterior cord of brachial plexus will lie posterior to the third part of axillary artery. I hope you have understood that. Now, the medial root of the median nerve usually crosses in front of the artery to join the lateral root and form the median nerve lateral to the artery. Okay, so in the axilla, the median nerve lies lateral to the axillary artery. So now the axillary vein Please note this, the axillary vein at all levels will lie anteromedial, anterior and medial to all parts of the artery. Now, the shape of the artery depends upon the position of the arm. When the arm is at the side of the, is at the side, okay, the arm is at the side of the body, that is, the artery will have a bold curve with its convexity lateral. Now, when the arm is laterally rotated and abducted, that is when it is taken away from the body, as in operations upon the axilla, the artery usually pursue a straight course. Now, in that position, the surface marking of the artery is indicated from by a line from the middle of the clavicle to a groove which is usually behind the coracobrachialis muscle. Okay, so let's look at these branches. Since we have divided the axillary artery into 3 parts, what are the branches? Now, the first part has 1 branch, the second part has 2 branches, the third part has 3 branches. Now, from the first part, we'll have this artery, the superior thoracic artery. From the second part, lateral thoracic artery and the thoracoacromial artery. From the third part, we'll have the subscapular artery and the anterior and posterior circumflex humeral arteries. Okay, so the superior thoracic artery from the first part, it is just a small vessel which runs forward to supply both pectoral muscles, to usually supply pectoralis minor and major muscles. Now, the thoracoacromial and the lateral thoracic arteries arise from the second part. Now, the thoracoacromial artery usually skirt the upper border of pectoralis minor and pierces the clavipectoral fascia, often separately by its 4 terminal branches. Okay, so in some population, it might pierce as a trunk, the thoracoacromial artery itself, or first it might divide to its 4 terminal branches, and these 4 terminal branches might pierce the clavipectoral fascia individually. Which are the 4 terminal branches of the thoracoacromial trunk? The thoracoacromial artery, sorry. We have the clavicular artery, deltoid, acromial, pectoral. Now, these branches usually radiate away from each other at right angles and to take the directions indicated by their names. So, the clavicular artery runs towards the clavicle, deltoid artery towards the deltoid muscle, acromial towards the acromion, pectoral towards the pectoralis major and minor muscles. Now, the lateral thoracic usually follows the lower border of pectoralis minor, supplying branches to the pectoralis and the serratus anterior muscles. Now, in females, it is large and it is important contributor of blood to the breast. Okay, so in female, it is large to supply the breast. Now, branches from the third part, the 3 of them. Now, the subscapular and the 2 circumflex humeral arteries arise from the third part. Now, the subscapular artery, which is the largest branch of the axillary artery, runs down on the posterior axillary wall. It usually runs on the subscapular muscle, giving off a dorsal branch. It gives off a dorsal branch, which is known as the circumflex scapular artery, which passes through the posterior wall of the axilla, that is between the subscapularis and the teres major, medial to the long head of triceps. I think that is through the lower triangular space. Then it usually curves backwards round the lateral scapular border. Okay, now after giving off the circumflex scapular artery, now the subscapular artery usually change its name from subscapular artery to the thoracodorsal artery, which runs with the thoracodorsal nerve into latissimus dorsi. Okay, and it usually give 1 to 3 branches to serratus anterior, and these branches usually anastomose with the posterior intercostal arteries. By that, anastomosis is important since it usually provide an alternative source of blood supply to latissimus dorsi if the subscapular or the thoracodorsal artery have been occluded or divided higher up in the axilla. Okay, so there be an alternative blood supply if there is blockage of the subscapular artery, because there is anastomosis between the branches from the thoracodorsal artery with the posterior intercostal arteries. Now, although the thoracodorsal nerve arises from the posterior cord of brachial plexus, It usually descends in front of the artery in the neurovascular bundle that usually enter the latissimus dorsi, close to its anterior edge. Please understand that. It does not lie posterior to the thoracodorsal artery, it lies anterior. Now, the anterior circumflex humeral artery runs deep to coracobrachialis and both heads of biceps, giving here an ascending branch which runs up the intertubercular sulcus, and it is an important source of blood supply to the head of humerus. Then it usually passes around the surgical neck of the humerus to anastomose with the posterior circumflex humeral artery. Now, which is the posterior circumflex humeral artery is a much larger branch than the anterior one, and passes through the quadrangular space in the posterior axillary wall that is with the subscapularis above and teres major above, but lateral to the long head of triceps, but medial to the surgical neck of humerus. Then it is usually accompanied by the axillary nerve, okay, and like it, usually it supplies the deltoid muscle and gives branches to the long and the lateral heads of triceps, and also supplies the shoulder joint before anastomosing with the profunda brachii artery. Okay, all those stories is this. Here we have your after, this is the subclavian, but after closing the lateral border of the first rib, it becomes axillary artery. Then after closing the lower border of teres major, it becomes brachial artery. Now you can see this is the pectoralis minor muscle here. It will divide the artery into three parts. First part medial to it, second part deep to it, third part lateral to it. First part, one branch, which is the superior thoracic artery. And the second part has two, the thoracoacromion, which will start the upper border of pectoralis minor and give off the four branches. You can see like this branch here is going towards the deltoid. So this is your deltoid. This is your acromion. This is your clavicular branch. This is your pectoral branch. Then at the lower border, you have the lateral thoracic, being larger in females to supply the breast. Then the third part has three. You have your subscapula here, but after giving off the circumflex scapula, it will change its name to the thoracodorsal artery. Then here we have your posterior circumflex humeral and anterior circumflex humeral, with the posterior circumflex humeral traversing through the quadrangular space together with the axillary nerve. The same here. So this diagram is the same as this. You can see here is the circumflex scapula, which will participate in the scapular anastomosis. Then distal to it, this is the thoracodorsal artery. This is the thoracodorsal artery, not subscapular. Subscapular is this part before the artery gives off the circumflex scapula, but after giving off, it becomes the thoracodorsal artery. Here is a cadaveric image. Let's start from the known. Okay, this is your heart. This is your ascending aorta. Then to give off three branches, the brachiocephalic trunk, left common carotid artery, left subclavian artery. Then your brachiocephalic trunk will give you your right common carotid artery and your right subclavian artery. Subclavian artery is divided into three parts by anterior scalene muscle. Okay, yeah. So it will have three parts also, but after crossing the border of the lateral border of the first rib, it will become your axillary artery here, which will have three parts. With the first part giving off one branch, the supreme or the superior thoracic artery. The second part, two branches. This is your thoracoacromial trunk, thoracoacromial artery, which will give off four terminal branches: the clavicular, your deltoid, your pectoral, and your acromial. Then the lateral thoracic, which will supply the breast. Then here you can see the largest branch from the axillary artery, the subscapular artery, which will give off circumflex scapula to continue as thoracodorsal artery, which is accompanied by the thoracodorsal nerve. Okay. Now, scapular anastomosis. The scapular anastomosis usually takes place at two sites, around the body of the scapula and over the acromial process of scapula. The arteries which are involved in the scapular anastomosis around the body of scapula include the suprascapular artery, which is a branch from the thyrocervical trunk from the first part of subclavian artery, and the circumflex scapular artery, a branch from the subscapular artery from the third part of axillary artery, and also we have the deep branch of transverse cervical artery, which is also a branch from the thyrocervical trunk. The thyrocervical trunk is a branch from the first part of subclavian artery. Now, the arteries which take place in the scapular anastomosis over the acromion process are the acromial branch of the thoracoacromial artery from the second part of axillary artery. Also have acromial branch of the suprascapular artery. Suprascapular artery is a branch from the thyrocervical trunk from the first part of subclavian artery. We also have the acromial branch of the posterior circumflexhumeral artery. Posterior circumflexhumeral artery is the branch from the third part of axillary artery. Now, axillary vein. It is a large vein which usually commences at the lower border of teres major as a continuation of the basilic vein. Now, at the outer border of first rib, the axillary vein enters the root of the neck as the subclavian vein, lying in front of scalenus anterior or your anterior scalene muscle. Now, the vena commitante of brachial artery usually join the axillary vein near its commencement, and the cephalic vein drains into it above pectoralis minor after it has pierced the clavipectoral fascia. Now, other tributaries correspond to the branches of axillary artery. Now, you will find the lateral thoracic vein draining into axillary vein. So, find the superior axillary vein draining also to axillary vein. Each artery from the axillary artery will have a corresponding vein. Now, each branch from axillary artery will have a corresponding vein. Now, the axillary vein has a pair of valves near its distal end, and the cephalic and the subscapular veins have valves near their terminations. Now, the axillary vein lies medial to axillary artery, which it partly overlaps anteriorly, so it lies anteromedial. Now, the medial pectoral nerve and the medial cord of brachial plexus, ulnar nerve, and the medial cutaneous nerve of the forearm will lie between the artery and the vein, but the medial cutaneous nerve of the arm will lie medial to the vein. Now, the subscapular veins are multiple and usually lie on the posterior wall of the axilla, and they are encountered during the surgical clearance of the axillary lymph nodes. Now, the lateral thoracic vein is connected by the thoracoepigastric vein to the superficial epigastric vein. Superficial epigastric vein is a tributary from the great saphenous nerve, and this communication channel usually become prominent on the side of the trunk in cases of inferior vena cava obstruction. So, the thoracoepigastric vein will connect your lateral thoracic vein to your superficial epigastric vein, and during inferior vena cava obstruction, blood now will be forced to use that route so that it can access the superior vena cava. So the thoracoepigastric vein will become engorged, it will become prominent on the side of the trunk in case there is an inferior vena cava obstruction. Here we have, let's start here at the lower border of teres major. The basilic vein becomes your axillary vein. Okay, you can see this is your subscapular vein and your lateral thoracic vein. Okay, you can see how it is related to these axillary lymph nodes. Then at the outer border of first rib, it becomes subclavian. The same here, this is your axillary vein. You can see where the cephalic vein is draining into. Then it will join with the internal jugular vein to form your right brachiocephalic vein, which is joined by the left brachiocephalic vein to form your superior vena cava. The same here. Okay, this is your basilic vein. Then it is joined by the vena comitante of brachial artery to form your axillary vein, which is joined by the cephalic vein. After it has pierced the clavipectoral fascia, then it will join with the internal jugular to form your right brachiocephalic vein. Now, the axillary lymph nodes, they are usually contained in the fibrofatty tissue of the axilla, and they usually vary in number between 20 to 30. Now, they are usually divided into groups. The anterior pectoral group usually lie behind pectoralis major along the lateral thoracic artery. that is at the lower border of pectoralis minor, and they receive lymphatics from the upper half of the trunk anteriorly and from the major part of the breast. We have the posterior of the subscapular group, which lie on the posterior wall of the axilla along the subscapular artery, and they receive lymphatics from the upper half of the trunk posteriorly and from the axillary tail of the breast. The lateral group usually lie on the medial side of the axillary vein and receive lymphatics from the upper limb. The central group usually lie in the fat of the axilla and receive lymph from the above groups, usually receive lymph from the anterior, posterior, and the lateral groups. Then the apical group, which lies at the apex of the axilla, receives from all groups named above. Then the apical group drains by the subclavian lymph trunk through the apex of the axilla into the thoracic duct on the left side or the right lymphatic duct on the right side, or it might drain directly into the jugulosubclavian venous junction in the neck. Also, a few efferents from the apical nodes will drain into the supraclavicular nodes, which are also known as the inferior deep cervical lymph nodes. Then, also, the axillary lymph nodes are described in terms of the levels at which they lie in relation to the pectoralis minor muscle. Level 1 nodes lie lateral to the lower border of pectoralis minor. Level 2 lie deep to the pectoralis minor muscle. Level 3 lie medial to the upper border of pectoralis minor muscle. Then the lymph nodes, which initially receive lymphatic drainage from an area of the breast, which is the site of pathological process, are usually termed as the sentinel nodes. And these are usually the level 1 nodes, which lie lateral to the lower border of pectoralis minor, and occasionally a level 2 and sometimes an extra axillary node, such as the parasternal lymph nodes. And the location of the sentinel nodes are usually confirmed by injecting a dye or a radioactive substance into the relevant site in the breast and demonstrating its drainage to the sentinel nodes visually or by use of radioactivity counter. So here we are. These are the lateral, they lie along the axillary vein. These are the posterior, line along the subscapular artery. Central, they will lie in the fibrofatty tissue. The anterior of the pectoral group will lie along the lateral thoracic vein. The apical will lie near the apex of the axilla. Okay, this drain the upper limb. This drain the posterior half of the trunk. This drain the anterior half of the trunk and the majority part of the breast. Remember, the posterior group will drain the axillary tail of breast. This receive lymphatics from this group and this group. Then they will drain into this group. This group will receive lymphatics from all these groups and drain them into the right lymphatic trunk on the right side and to the thoracic duct on the left, or directly to the jugulosubclavian venous junction, or a few lymphatics might drain into the supraclavicular lymph nodes or the inferior deep cervical lymph nodes. So thank you for your attention, guys, and please subscribe for more anatomy and biochemistry content, and stay tuned to watch for Axilla Part 2, where I will discuss the brachial plexus, which is a must know. So thank you.